Hi, really happy to see all of you here and see that we have remote sites as well. And so I'm going to introduce myself. I'm Doris Fountain. I'm a registered nurse who's worked here at A.T. Still University from before it was called that, back in 1985. And we've been a funded grant-funded program with the State Department of Health and Senior Services for the regional arthritis centers. We do more than give service to people with arthritis. We really try to help people with chronic conditions to get better management of their chronic conditions, and for those who don't have chronic conditions, to keep from getting them. Okay? So steps to better health. The self-management education for people with chronic conditions or at risk for chronic conditions. But that's a little bit too much to put on a title slide, right? As I said, we are funded through the Missouri Department of Health and Senior Services. We've had some extra funding from the Agency on Aging, or NCOA, National Council on Aging, that channels through the University of Missouri as well at Columbia. So on your handout sheets, you have me as a contact person, so that if you have any questions, please be sure to shoot me an email, and I'll be happy to try to send you more resource material or more information about contacts in the outlying regions. So for each region of the state, there's a select number of counties that are served, and so we serve 16 counties in Northeast Missouri. And needless to say, one coordinator can't give the programs in all of those places. So we have to recruit just lots of partners and professionals and community groups and organizations to really help people to live healthier lives with it. We have a local advisory board, and each of the regional arthritis centers does. And you're going to see a picture of that in just a moment. And then the community programs are very participatory. Don't try to say that fast while you're eating. And we don't really give treatment to the individuals, but we help them adhere to their treatment plans better. And that's a really important piece of getting people to get well or stay well. Oops, I hit it just a little too hard. There are 7 regions that the state of Missouri is divided into, and we're a very unique state because there aren't states that have regional arthritis center programs that are funded, other than maybe 1 or 2 others, but we were kind of the front runner on that. And so for those of you who are in Southwest, you'll want to get a hold of Heather, and you have her address on the resource sheet that goes along with this, the first one that's toward the back of your PowerPoint slides. For those in Southeast, it's Oli, and I'm not going to try to say the rest of her name. And so when you see brochures out and about that have steps to better health and a man carrying his grandchild probably on his shoulders, it probably has a different name on it because Oli's new in Southeast. In Northwest, it's Debbie. In Northeast, it's Doris right now, and I hope to get someone alongside me soon. But you have the numbers for those on the sheet that is actually 2 pages that says Missouri Regional Arthritis Centers. And then the second page starts with Know the Facts. It gives you a little bit more information about what regional arthritis centers' real goal is and so on. So the second page shows specifically which counties are served by each of those centers, so that if you're in kind of a corner, you can try to identify which service area you really would be in. But the overall goal is to improve quality of life through early intervention, education, service, and collaboration. Remember, I said we had to have a lot of partners to get the work done in order to have these services available for people. So this kind of gives you a few more bullet points to look at related to what we're doing with it's more of a community health approach. And so we're trying to improve the health and quality of life for all people with chronic conditions or at risk for chronic conditions. If you have more birthdays than 50, you probably are at risk for chronic conditions. Would you agree with me on that? It's a risk factor on just about everything. Promote successful disease management through education and physical activity programs. And we have a lot of fun with our physical activity programs. We have some people that who've been in Kirksville in the Thompson Center might have seen some exercisers that look like they're about 90, and some of them might be above 90, and they count that as their insurance to keep out of the nursing home. So it's doing well, right? They're doing what they want to do. And then the last thing is we really encourage that early recognition, diagnosis, and professional care so that they don't think, hey, I can do this all on my own, but I'm going to work with my physician or my healthcare team and make it happen. So the partnerships and the network of self-management educators that we train really help us to expand the capacity of health providers and of health agencies and health service organizations. And so partner options like some particular hospitals will actually train some of their nurses and social workers or maybe their rehab program people to deliver the programs. In some areas, they don't have enough staffing to do that, and so they refer to existing programs that are already in place. In Northeast Missouri, we're very fortunate to have a rural health network office, and the people there are trained to deliver the chronic disease self-management course from Stanford, the powerful tools for caregivers course from Stanford, and the diabetes self-management course from Stanford. And so they rotate what they're offering, and they've just finished up a diabetes course, and they'll start on the caregivers course about next week or the week after. So if you know a caregiver that should be referred to something, get a hold of me and I'll get you the number for that. So that's a big piece, is to keep your caregiver well too. So each of the regional arthritis center provides training for volunteers and partner agency staff, and then we provide materials and leader support to ensure the fidelity or the adherence of that program to the evidence that shows that these work. And so the programs offered should all be the same, whether it's Southeast or Northeast or Southwest, or even in Utah or California. Actually, they're internationally offered in, I don't remember how many languages, but a lot of languages. And so they've done a lot of research with it. The chronic health problems, just to touch on them, that benefit, and this is not an exhaustive list, needless to say, but anyone with arthritis, heart and lung disease, high blood pressure, diabetes, osteoporosis would probably benefit from being in some of the programs. But we've had people with cancer and stroke and just a number of different things that have said how much this has really helped. So I want to kind of put a little bit more emphasis on the fact that prevention is the key for chronic conditions. It's best if we can prevent the disease process to begin with, but we want to prevent the complications of the chronic conditions as well. So it's kind of a primary or a secondary kind of thing that we're looking at there. And so it really is very beneficial to refer people that you're working with who are at risk for some of those conditions, because the tools that they learn to use and practice using in the courses can really help them to prevent not just the disease, but complications from the disease, and maybe make it even easier to manage. So I had an 80-some-year-old who had had his diabetes for at least 30 years, who was able to get off of insulin and resume some things that he had not been able to do previously, that was really excited that he had taken the course. So a lot of people spend way too much of their time in this square, the urgent and not important square, and the not urgent and not important square. Has anyone ever wasted time in any of those squares? One honest person in here, yes. And then we don't have enough time left to do the important but not urgent, because we got crowded out with all those other squares. And so chronic disease management kind of really fits in that square, doesn't it? So let's take care of it. Let's stop the symptom cycle that's kind of a real vicious cycle that they feed on one another, and it doesn't have to be that the physical limitations cause the pain or the pain the physical limitations. It can go across, it can go down. People in pain sometimes have some pretty difficult emotions. And so what we're working at is trying to use tools like these, and I know the words will probably be pretty small in the remote sites, to break that symptom cycle. And so you can see how if the person gets the proper physical activity, how many of those points on the symptom cycle might it impact and help them to break the cycle. About every single one. Difficult emotions, I have friends who, yes, they run instead of taking an anti-anxiolytic or an antidepressant, okay? So problem solving, we need that whether we have chronic conditions or not, but sometimes we really need to do some problem solving with those physical limitations so that we can do the things that we want to do. And so each one of the things kind of can really impact. And so I'll just quickly touch on a couple of them. Using your mind. So one of the pain management, many of our chronic pain management programs incorporate helping people learn relaxation techniques and so on. And so we help them learn to use their mind to manage symptoms and get a handle on that. Communications, and that's with their family and with their healthcare team, and understanding their emotions so they can have better control of them. And finally, in the chronic disease course, we have a little bit about weight management. And of course, that appears some in the diabetes self-management course as well. So I did make a copy of the overview of the course, so those in Kirksville could see that, but I'm not saying that it's appearing as a handout for the rest of you. So any of you that would like a copy of what the course content actually is, just email me and I'll just send you a little PDF of what the course content is on those. There is at the back of the handout sheets here in Kirksville, and you should have it if you're using your computers, one that's called Strategy, Chronic Disease Self-Management, and we'll talk about it a little bit in the next few slides. And so it really looks at the research benefits of self-management. Is a little farther on, but fewer symptoms such as pain, shortness of breath, less fear and worry, self-efficacy for disease management, an improved ability for activities of daily living and the person's quality of life. So the big thing is the umbrella goals for a strategy to make their lives better is that self-management programs who want to use things that are evidence-based are proven to have really provided the education and support, and that they do improve the quality of life, and that they increase adherence to medical treatment plans. And so the target triple aim of these programs really dovetails with the triple aim of Medicare in the new health reform status. The stated things are better health care, and reduced costs. And so these programs really help you to achieve those goals that makes Medicare really happy. Okay? So then the next thing that, it has some other things on that page, but another thing that I really wanted to point out with is that really when we have people engaged in these programs, often the standard measures of their disease control improves, such as they can actually see improvement in range of motion for people with arthritis. They can see improved A1C levels in people with diabetes and so on. So we can document the progress that's really being made there. Also, education and support that improves the treatment plan adherence. And so I think the easiest one is that we can show particularly that they're eating healthier choices in their meal plans as they practice making meal plans that really are balanced and so on. Performance goals, and the people really do help to set their own goals because it needs to be something they really want to do. And they make an action plan each week if they're willing. If they're not, we don't get stuck there. We just go out, and usually they make one anyway because they feel the pressure of the rest of the group. And then it does make an impact on quality scorecards reported by health plans and federal government for the individual who participates in these courses. So a lot of people are using the internet to check scorecards. And so it's really beneficial when you can be referring people to programs like this, and they can get a little extra point or two on the scorecard that's being kept about our quality of care. So the Stanford University programs that are offered in the different regional arthritis centers are listed here. Chronic disease, Comando Control de su Salud, so it's the chronic disease course in Spanish. And we are going to do our last class in Milan on Tuesday evening for that series. Better Choices, Better Health is an online course for those people who are not able to go to a class that physically because of location or because of their work schedules and so on. That might be a choice. At this point, we do not have that as a free option, and all of the other ones we have been able to offer without cost. The Arthritis Self-Study Toolkit, and I have a sample of that with me. And so it's a little box. It's not a heavy toolkit. It doesn't have a lot of hammers and so on in there. Instead, it has a small book about how to live best with arthritis. It has some CDs for exercises that are really very gentle, medium, or more progressively for as they are improving their strength and into routines. And then it has relaxation CD, and it has some little diagrams of the exercises and so on in it. So if you have someone who really can't get out because they don't drive and they live in a rural community, or if they're housebound and would like to be making some progress, that would be a possibility, or something that we could give to them for using, and then they can return it if they don't need it anymore because they're pretty expensive. So toolkits, and then the diabetes self-management program is another one. Then we do have programs besides the Stanford programs. We have Arthritis Foundation exercise program, and that's a small group exercise for fun and fitness, like I said, and it's easy exercises for everyone. And then Walk with Ease program that is developed by the Arthritis Foundation, but its target audience is for anyone who would benefit from increasing their ability to walk. And so if they're already walking, they might get some good walking tips because it talks about how to prevent shin splints and things like that, you know. So there are a lot of extra tips in that, and they can walk as groups or as individuals. And so we would be happy to, and I have the course book for that, and I have the course book for AFEP, Arthritis Foundation Exercise Program, and then this is the general book that would be used for the chronic disease courses, both diabetes and the chronic disease. So if anybody wants to look at those, you certainly may. And then we have a short program, Put Pain in Its Place. Place didn't show up there, and I didn't catch that. But it's a really good program that we can put on in churches or in community centers or in clinics and try to get people interested in what they can do to get a handle on that pain and really go forward with feeling better for the next few months, right? So we would be happy to do that 1 hour presentation if you know of anyone that wants that done. So other things about steps to better health, self-management options that are offered, and I've already gone over that. So that's a little bit redundant, but it's to really emphasize it, right? These are the ones that are the most common of the self-management options. And so the chronic disease self-management course is called many different things. In central Missouri, they call it Show Me Better Health. In northeast Missouri, sometimes we call it Living a Healthy Life, or Living a Healthy Life with Diabetes, or we call it Live Like Your Life Depends on It. And I can't remember exactly what title they like to use in the other regions. So it might depend on the provider. Like if it was a particular hospital, like St. John's Hospital in Southwest, they might pick a title that they kind of really like to promote their program as being. So I think I missed a page of my things here. Okay, so a good question that you can ask your patients when you see them is something of kind of introduce the idea of, you know, you really can take an active role in your health, and so what would you like to do? And find out something that they really would like to be able to do to take a step toward healthier living. So the workshops have the people report after they've been in the workshops that it really helps them to be more independent. It helps them to be able to do the things that they like to do. It really makes them feel better when they exercise, and it helps them move more easily. When we take a break from our Thompson Center class, they come back from Christmas break, oh, I'm so stiff because I didn't do my exercises over the Christmas holiday. And so it's something that they really do see the benefits for. So on the small groups that are like the chronic disease courses, because it's usually kept to 15 or under in the class setting, they feel good about interacting with one another and giving each other ideas on, hey, if you're having a problem with that, I used to have one like that, but then I did this, and it really worked. And so they really do help one another. So the peers and the experienced peer leader really helps. 2.5 hours, some of the classes are small enough.
The surgery safety huddle will meet at 1 p.m. The surgery safety huddle will meet at 1 p.m.
Is that something you all needed to know? Okay. All right. Some of the places, everybody knows one another, so they don't have to have as long a break time, and they don't take quite as long to do the interaction thing. So a lot of them, it's really 2 hours a week for the 6 weeks. And they might meet on Monday afternoons, each Monday or whatever. But they really do share the progress and support with their friends. The topics are listed here a little bit, since you don't have that for a handout particularly, but there are more topics in these. But physical activity, essentially we talked to them about that probably in about 4 out of the 6 classes in the 6-week series. Managing fatigue, stress, and pain, it would be identified on their sheet that just kind of gives them an overview of which week we're going to talk more about which topic and so on. We use problem solving pretty much every week except the very first session, because when they come back to report on their action plans, if someone hasn't been able to complete their action plan, then we ask them if they can identify why it was they couldn't. And then if they can identify a way that they could succeed, if they wanted to try that again. And then if they want help from the others about what some ideas to solve that problem would be. So we do a lot of problem solving. And then we actually do have, on very rare occasions, that they might have a problem that wouldn't be solvable right now. But they learn to accept that sometimes that's it too. And so it has a very appropriate way to help people face those problems and look for solutions. Healthy decision making, and of course the example that they use is about my doctor recommending that I start this new medicine. And what are the pros about why should I start it? And why would I not want to start it? And then it goes through scoring that so that they see that, yes, probably I would benefit from starting this new medication. Healthy eating plans, it really works on healthy eating plans for everybody, and that's going to help prevent problems in almost any of the chronic conditions. Communication and working with the health care team and medications. So it has some more, but we won't go into every one of them. Okay, so the exercise program from Arthritis Foundation, I told you it was community-based, and then it was for fun and fitness, so recreational is what its overall stated position is. The goal, though, is to really improve functional ability, decrease depression, increase their confidence in their ability to do some physical activity. And so we spend time doing some range of motion and some endurance building activities, some relaxation techniques, and we have some health education topics in those programs. And a lot of times, if you take just a little time to say, okay, what one didn't we do that you really love and and wouldn't want to miss today, those that have been coming on a regular basis will say, oh, my favorite is, and you'll know exactly what one they're pointing out. Okay, the Walk with Ease, if they're really engaged in doing a group, they try to compress that into a 6-week program. But on page 9 of the book, it tells them what chapters of the book they should read and what self-test they should do in order to be on target to finish it in 6 weeks. And so the 6-week outcomes that they're able to report from their research is that the people with arthritis or other chronic conditions do report reduced pain from this. We had a man in Edina, which is about 25 miles east of here, that was enrolled in the Walk with Ease program because he was so distressed that he had to have a lift chair and he couldn't walk his dog around the block. On the first quarter of the block, he would have to sit down and rest. And by the end of the 6 weeks, he was able to walk 30 minutes without having to rest and get his breath. So, and much reduced pain, improved flexibility and strength and stamina. So really exciting to see the improvement in some of the people. And in improved confidence that to be physically active can be helpful to their health and how much better they do feel. And then improved overall health. So, so some places may have some prescription pads that you can use as a referral opportunity and so on. And so, whichever one, if you'll contact your regional arthritis center for what it is that you would like information about and how you can go about doing referrals. Here in our Kirksville room, I gave you some yellow slips of paper that you can actually hand out to any patient that you would have if you felt like it was something that you wanted to have them get a hold of us. And that way it doesn't tell particular dates and times and everything, because we serve 16 counties, and you might see someone from up in Clark County, which is 70 miles away, and then we could tell them the closest one to them, okay? The beauty of the electronic medical record is a lot of times it will prompt you, what are you doing about the education for this person? And this gives you something referred to Regional Arthritis Center that you can just put in, okay? And if you figure out how to make it that you can do a one-touch, I know in the OMM resident program up in the office, they're trying to make it so that they can just, with one button, kind of make that referral and get it into their medical record. So if you can figure out a way to make that happen, that would be great. We'd love to try to help the people. So, if you have any questions. Awfully quiet. Are there any questions from the outlying regions there? I hope you can hear me all right. It's pretty quiet, doesn't it, Angela? I think they're ready to take a little bit more of a break here at lunchtime and get on. I do appreciate your attention, and I hope you're excited about meeting the needs of our patients in Northeast Missouri and keeping them well, getting them well, and keeping them well. Thank you very much.